NCLEX RN practice tests free 2026 questions for unlimited practice. Question 1. An unconscious patient is brought in after a fall from a 2-story building. Which assessment finding should the nurse be most concerned about? Option A, reactive pupils. Option B, a depressed fontanelle. Option C, a bleeding from ears. Option D, an elevated temperature. The correct answer is option C, bleeding from ears. Bleeding or cerebrospinal fluid leakage from the ears, otorrhea, is a sign of a basilar skull fracture, a critical emergency. Question 2. Which piece of information indicates a knowledge deficit regarding the management of a cardiac pacemaker? Option A. Take your pulse rate once a day in the morning. Option B. Maintain a safe distance from high-powered electrical devices. Option C. Regular follow-up care is important. Option D. You may engage in contact sports. The correct answer is option D. You may engage in contact sports. Patients with pacemakers must avoid contact sports to prevent damage to the device or dislodging the pacemaker leads. Question 3. Which statement reflects the most relevant knowledge about oxygen administration to a patient with COPD? Option A. Oxygen at 1-2L/min is given to maintain the hypoxic stimulus. Option B. Hypoxia stimulates central chemoreceptors in the medulla. Option C. Oxygen is administered best using a non-rebreathing mask. Option D. Blood gases are monitored using a pulse oximeter. The correct answer is option A. Oxygen at 1-2L/min is given to maintain the hypoxic stimulus. In some COPD patients, the drive to breathe is triggered by low oxygen levels, hypoxia. Excessive oxygen can suppress this respiratory drive. Question 4. Placing a post-pneumonectomy patient in Fowler's position on either his right side or back primarily. Option A reduces incisional pain. Option B facilitates ventilation of the left lung. Option C equalizes pressure in the pleural space. Option D increases venous return. The correct answer is option B, facilitates ventilation of the left lung. Positioning the patient on the operative side or back allows the remaining lung, in this case, the left, to expand fully and maximize ventilation. Question 5. In teaching a patient what to expect after a bronchoscopy, what is the highest priority information? Option A. Food and fluids will be withheld for at least 2 hours. Option B. Warm saline gargles will be done every 2 hours. Option C. Coughing and deep breathing exercises will be done every 2 hours. Option D. Only ice chips and cold liquids will be allowed initially. The correct answer is option A. Food and fluids will be withheld for at least 2 hours. Following a bronchoscopy, the gag reflex is suppressed by anesthesia. Food and fluids must be withheld until the reflex returns to prevent aspiration. Question 6. For which condition should the nurse expect hypertonic glucose, insulin infusions, and sodium bicarbonate to be used? Option A. Hypernatremia. Option B. Hypokalemia. Option C. Hyperkalemia. Option D. Hypercalcemia. The correct answer is option C. Hyperkalemia. Insulin and glucose work together to shift potassium from the extracellular fluid into the cells, rapidly lowering serum potassium levels. Question 7. Which statement by the nurse is most appropriate for a patient diagnosed with condylomata acuminata, genital warts? Option A. This condition increases your risk for cervical cancer. Option B. The usual treatment for this is metronidazole, flagyl. Option C. Using condoms completely eliminates the risk of transmission. Option D. HPV cannot be transmitted during oral sex. The correct answer is option A. This condition increases your risk for cervical cancer. Condylomata acuminata is caused by HPV, which is strongly linked to the development of cervical cancer. Regular pap smears are essential. Question 8. Regarding the anatomy of the kidneys, which of the following is true? Option A. The left kidney usually is slightly higher than the right one. Option B. The kidneys are situated just above the adrenal glands. Option C. The average kidney is 5 cm long and 2 cm wide. Option D. The kidneys lie between the 10th and 12th thoracic vertebrae. The correct answer is option A. The left kidney usually is slightly higher than the right one. The right kidney is usually slightly lower than the left because it is displaced downward by the liver.